Welcome to Friends with Fertility, the podcast where we dive deep into the world of fertility, reproductive health, and all the emotional journeys that are in between. I'm your host, Elizabeth King, a fertility expert dedicated to providing you with the knowledge, support, and inspiration you need on your path to parenthood. Whether you're just starting out, exploring your options, or looking for solidarity and advice, we are here for you. Let's embark on this journey together and turn uncertainty into empowerment and make friends with fertility. Let's get started. Hey everyone, welcome back to Friends with Fertility. Today we have Dr. Rachel Mandelbaum. Welcome, Dr. Rachel.
Thanks for having me. So excited to be here.
I'm going to fill you all in on her very impressive bio, and we are really going to be diving into what she's, I don't know, do we use the word invented with a needleless IVF? What's the word that you...
It's just a technology and kind of a method that I've created, let's say, but didn't invent the device, so to speak.
Okay, well, it's super impressive. So she is a reproductive endocrinologist and infertility specialist at HRC Fertility in West LA and Beverly Hills, and faculty in Obstetrics and Gynecology at USC Keck School of Medicine. Dr. Mandelbaum is a fertility physician, researcher, patient, and advocate with a core mission to improve the patient experience of fertility treatments while pushing the technological envelope for the best pregnancy outcomes. She completed medical school at the David Geffen School of Medicine, followed by residency and fellowship training at the LA County Center and USC. With over 100 peer-reviewed publications, which is a ton for any of those listening that aren't aware, Dr. Mandelbaum has contributed significantly to the field of reproductive medicine and is committed to pushing the envelope through both basic and clinical research. Notably, she created and validated a new method of IVF medication administration called Needle-Free IVF, which has made a positive impact on so many of her patients' fertility journeys by removing the need for frequent injections. She developed this on herself during her own IVF cycle and has demonstrated its efficacy in her published clinical trial in Fertility and Sterility. She also actively collaborates with the Zernica Getz lab at the California Institute of Technology and understands key stages of early embryonic development. In addition to clinical practice, she adores her two toddlers, Aaron and Miles, and juggling life with her husband, Landon, who is an orthopedic surgeon. That is, I don't know, like, how do you have time?
Bio. That is a long bio. So sorry.
I mean, that's my first thing is like, how do you have time, really? And this is not a podcast about balancing life and work, but
that's all part of it. I mean, it's a juggle, and I think it's all intertwined, right? It's because I've tried to figure out balancing family and my own fertility journey, that I understand like what a lot of my patients are going through, and it's all a balance. But I love what I do, and I wouldn't want it any other way.
So you were on your own fertility journey, which I think is interesting and awesome at the same time. Like, not awesome that you had to go through it, but the fact that you can be there and really empathize with your patients is a very different experience than I was looking at Dr. Werlin, who is my doctor, to know he's never gone through this, right? So how has that changed just you coming to the table to your patients, having been a patient?
Yeah. I mean, first of all, I will say I adore Dr. Werlin, and all of his patients are so very lucky. But I think it's changed things for me. I think I just understand the little things that make it stressful, and also that, I happen to be fearful of needles, right? The idea of going through IVF for me, that was sort of one of my first thoughts, right? And as I was kind of preparing for the process, I was like, wow, this feels so unfriendly. And this is my perspective as someone who's in the medical field, and I'm having all this anxiety, and I was sort of embarrassed about how I was feeling about it. And I was like, well, wait, I'm sure this is so much more of an issue for patients. And I think as I've done more research, I've really realized that it is more of an issue than I think we gave credit, right? I think that when people have the 5 minutes with their doctor or whatever it is in a monitoring appointment, yeah, maybe they're not focusing on the injections. Maybe they're more focused on how many eggs are growing and, transferring their embryo and all of that. But I think if you talk to our nurses, they definitely know that this is an issue that causes a lot of people anxiety. And so, having been there and realizing that it kind of in a way just compounded all of the very real stressors in this process, for me was kind of the motivation behind it. And then it also just like, I really understand how very stressful it is when you're waiting for that report, how like, the time between fertilization and finding out how many embryos you have, that is a very, very stressful few days. And I think, um, just having been there gives it a different kind of perspective, I think.
And I don't know if how open you are with your patients, on a day to day. It probably is not something that just comes out in conversation. But I do think that as a patient, knowing that about your doctor does probably change the dynamic between you and your patients to know, okay, she gets where I'm coming from. I would imagine that's a huge thing for them.
I actually am extremely open with my patients. I talk about my own journey all day long with them because, well, first of all, I'm kind of a heart on my sleeve kind of person. Like I will tell anybody about this, because I think it deserves to be talked about. I mean, I think the reason why we feel so much stigma about fertility, miscarriage, all of this stuff is because people don't talk about it. They only talk about it when they've met success at the end. And so, there's a lot of bias out there. And I always tell my patients, like, you know, I find a lot of people coming in after just a couple months of trying, and I'm like, actually, that's pretty normal, right? Like, I think we have this bias of people who get pregnant on the first try and then they want to tell you they did because, but you don't hear about the people where it took a long time and the people who struggled because they tend to struggle quietly, which isn't fair. And so,
And we're always taught, or we hear the narrative growing up, like, don't have sex, you're going to get pregnant, right? So we think in our heads that's what's going to happen. And then
yeah,
we hear somebody say, oh, it happened the first try or whatever. So it's
yeah.
a combination, I think, of a few things.
Yeah, so I'm really open with my own story, and I think that's something that's really important.
For sure. From my perspective, I remember thinking even then, like, it's just another day in the office for them, everyone in the clinic who I adored, and you get to know them so well. But for me, it was life changing, right? Whether it was the phone call about, whether it was your beta testing or the blood work or whatever it was, it really did change how you were going to do the next few days and what was going on. So I'm so glad to hear that you share your story with your patients and with the world for that matter, because I think that really does make a big difference. And I remember too with the needles, like specifically saying to their nurse, I'm not qualified to be doing this. I was doing it by myself at the time. And yeah, wasn't in the medical field. And I felt like, oh my God, what if I mess this up? And whatever. So take us down the road of the inception of just the idea of that light bulb moment of like, okay, I think I have an idea about this.
Yeah, so when I came up with this idea, I knew I was going to be going through IVF, and I was actually working with pregnant patients who had type 1 diabetes. So this technology is all borrowed from our friends who have diabetes, right? They have optimized subcutaneous technology because of insulin and the hormones that we use for IVF are two of kind of the most frequently used medications that can't be given orally, right? Because they're proteins, and so if you ingest them, they'll be digested, right? So I remember talking to this one patient, and she was like, "This pump has been life changing. Like I hated injecting myself constantly." And then in my mind, I was like, "Well, hey, I'm about to do all these injections. Like, how do I get one of those? And can I put IVF meds through them?" Or through it. And so then a light bulb kind of went off, and I ended up trialing it on myself during my own cycle, and it went great. And
Like,
look,
is it easy for you guys as doctors to like call your friend that you were in school with and be like, hey, can you like, was that an easy process to get one or what? Like, how did that work? Is there a
at
black market for the,
Yeah, that's
the
a good question, actually. So I actually haven't been asked that before, but it is a story. So at that point, I was like, okay, how do I do this? Do I actually create my own catheter? And I met with some biomedical engineers at USC where I was at the time, um, and we were going through the whole process. And I was like, okay, if I make my own, this is going to be years in the pipeline, right? We're going to have to do, so much clinical testing. And I was like, okay, but like I want this now. So I ended up finding a wonderful company who does a lot of diabetes technology, and they make a slightly different product that's actually geared more towards. There's a couple different medications that they use through it. Some of it's like for hospice patients who need pain control, and that can be given subcutaneously. Some of it's for like immune medications that need to be given subcutaneously, and so they have had this product which um, was wonderful and served all of the needs that we had. And so I just called them up and asked them, like, hey, will you partner with me for this study? And will you just send me a couple to try on myself? And so they did, and it worked great. And then they provided the devices for our trial later on. So I did it on myself. It worked great. I have a very, very low egg count. And so
were you prepared for it not to work or were you pretty confident like, no, of course this is going to work. Why wouldn't it?
I was so confident it would work. I mean, look, like we have all of this data from diabetics where they've given insulin through it and it's controlled blood sugar as well. And I was definitely monitoring my own hormone levels throughout the processing. Okay, what's my FSH level? Is the you know all of the hormone that I'm giving through the catheter being absorbed into my bloodstream? And so that was kind of cool too, to like be able to see, in your own body how you're responding to it. But it all went great. I mean, I really enough medications have been given through this technology, and there's no reason why it wouldn't work, right? Unless you see it leaking out, that medication is getting into your subcutaneous compartment, so to speak. And it should work just the same. So I had anticipated though that my cycle would not go very well given my low egg count and all of that, and it actually went okay. Um, for kind of my prognosis went great. And then I like fast forward, we designed a clinical trial and compared a group of women who were using this device to a group of women who were doing needle injection. And we looked at their hormone levels because, like we were saying, in IVF, everything, all the hormone that you're giving, right, you can measure in the bloodstream. So it's actually even a cleaner study than diabetes, where you're looking at, okay, insulin, how does that translate to glucose levels, right? That's more indirect rather than just like what you're giving, you measure. And it was not any different using this device. And so it's really just now another option that my patients use. And like 60 to 70% of my patients use it now.
Why wouldn't somebody use it? That seems like such a no-brainer. Like, of course I'm going to do this. Why would somebody choose not to?
So I think it's good for some people and not for others, right? Certainly, if somebody has no problem with injections, then why would they wear something all the time during their cycle when they can just inject, a couple times at night before bed? But there's other people where you tell them, okay, you're going to have to do 30 injections in these 2 weeks during your IVF cycle, and their jaw kind of drops. And whether they're extremely fearful or they're just like, okay, I'm going to be doing it to myself, and that's not something that I really want to have to do if I don't have to. I think people feel all different sorts of ways about this part of the process. And so I think it just creates, again, more options. And I think that's what we should all be about, is more options. Doesn't have to be for everybody, but can really help some people. And I can tell you that I think part of it is bias for who seeks me out because of this technology. But I think I have had countless patients come through my door saying like, I've delayed the IVF process. I know I need to do it, but I just have been like putting it off
Yeah,
because,
they're
and
scared.
particularly egg freezing. A
Mm-hmm.
lot of egg freezing is one of those things where people are like, oh, I'm going to do it in a couple months. Um, and so I think for those people, it's made a big difference.
For sure. I do think that the idea of IVF that people have is this big, big bad wolf, so to speak, and so regardless of the needles or not, I think most of the time people are pleasantly surprised that it actually isn't as bad as they've made it up in their head. But now that there's even another option, I mean, that's brilliant. And congratulations for your light bulb moment. That's so cool. And is there any downside to that? Like, did you notice with anybody that you've worked with, like, oh, this happens or that happens? Is there anything that's come up that people should be aware of about that?
Not major things. I mean, you're wearing a device, right? So there's the potential that you could pull it off by accident, or you could, you know, if you leave it on too long, notice some leakage or something like that. Now, the default if something like that happens is you just either come in and we replace it, or you just inject one night, right? And there's also, I have not seen this in any of my patients yet, but there is a theoretical kind of very rare risk of infection with having, a catheter on your skin. Now it's really, really rare. I mean, we like hardly ever see it like in diabetics who use an insulin pump and all that stuff. It's very safe technology. But it's a difference, right? If you're just injecting yourself, the risk of infection is, very, 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 very low. So that's one of the differences. But in general, I feel like people tolerate it really well, and hasn't caused a lot of issues with troubleshooting it and all of that. And I think patients are really happy.
So do you feel like this is going to be gaining more traction? I feel like it's still, net new, right? Not a lot of people know about it or talking about it too much.
Yeah.
Of course, you're getting the word out, which is great. But as far as the overall, do you think that it is gaining more traction? What do you think the the lack of frequency, I guess? What do you think the downside is for the getting it going? Where's
So
the delay?
I think
I
yeah.
guess is what I
Yeah,
should
no,
say.
I understand what you're asking. I think it is two-sided, right? I think there's some hesitancy to changing something that's working well, right? Having a baby going through IVF, it's all a very high stakes process, and I understand that. And so I understand people's hesitancy to changing what they perceive to be a good thing, right?
Are you talking about doctors or
I'm talking
patients?
about doctors.
Okay, great.
Talking about
Me too.
doctors, right? And I also see hesitancy on the patient side, right, for trying something different, right? To say, okay, well, how many people have done this? And when I tell them, well, I've had a few hundred go through, they're like, okay, but I want to hear thousands and thousands, right? And I understand that 100%. And for those people, maybe it's not right to try this technology. Totally fine. But it works just the same. And I think part of it is just people's hesitancy about rocking the boat for something that is, such a high stakes process, physically, emotionally, financially, all of that. I understand that completely. I think I have been a little bit surprised though at, sort of the slow uptake, because I think it also creates a little bit of, you have to reteach staff how to use it. You have to all of that. So I'm working on it. It's something I really want to work with clinics and make sure it's available and accessible, and the patients who need it and want it have access. I think that's really important. But I also, on the other hand, have seen people like even internationally. I get like messages of people who have started doing it in their clinic and telling me like how happy their patients are, and so So, on the other hand, it's been really fun watching it expand, and something that just was like this crazy idea in, a county clinic turn into something that now people are using, across the world.
Yeah, that's so awesome. I was just wondering if it's like, is it easy to get the catheters and it's not like there's no issue with that side of things? Because I know sometimes even with people getting medications and paying for medications for IVF, it's sometimes covered by insurance, sometimes not.
So it's
Like,
not the
does this play
easiest.
into any of that?
It's not the easiest. Like, the clinic has to figure out how to get catheters and kind of to supply patients with it. It's not something that's so easy to just go buy as a patient, right? So that's definitely part of it. And I should also mention, and this is really important, is that it's not FDA approved for IVF. So as physicians, we use things off FDA label all day long, right? All the time. We use medications that are approved for one thing or devices that are approved for one thing for something else, and we can do that as a physician. But a company can't market something off FDA label, and so that's part of it. That's why it's so hard. You can't just like go buy this for IVF unless your physician specifically like prescribes it for you because it's off FDA label, and it's really for consumer protection. But in a setting like this, is an unfortunate obstacle.
Gotcha. So if there's somebody listening who is not in the LA area and is going to a doctor already, is this something that they can ask their doctor about and say, they saw this or heard this and they want to try this out?
Yeah, they can definitely mention it to their doctor. I'm working with a couple of different clinics across the U.S. trying to help them implement this, and happy to work with different clinics all over to try to make it more accessible.
Because I feel like as patients, that's part of what we can bring to the table of expanding this is educating our doctors with what we are learning, right? I think I always tell doctors now, wait, get ready for the patients coming in because they are so educated and they know a lot about a lot of things.
Definitely.
Granted, we still need to look to you guys for the final say on things. And I always make sure that people know that, but also expanding the mindset some of these doctors that are kind of old school and do feel like, well, this is how I've always done it, so this is how we should do it. I think it's helpful to have
A
somebody to bring
hundred
in.
percent. And I think it's also like how you're hearing about something, right? Like, this is something that I presented at our medical meetings and published on and all of that. So it's there from the medical side of things. But also, from the social media side, like patients might come across it in social media and bring it to somebody's attention. And so I think that that's how we spread the word. And I agree with you. I think people asking for it, advocating for themselves, is a really important part of the puzzle.
And I think that's a great point. Oftentimes people find things on social media, but we don't have the studies to back it up. But in this case, there are studies to back it up. So we will post that in the show notes so that if you are going to somebody to talk about it, you have the information on hand as well. But before we go, I'd love for you to share with our audience your IVF story and how you got to your little guys.
Yeah. So, when I was a resident, I knew, and my story is a little bit different because the medical field is not is a really hard field to create a family, and there's so many fields out there that make it really difficult. But I do have to say, between my husband and I in medicine, it felt like such a big obstacle. Like, neither of us, we were both in surgical training, neither of us were like, how would we even raise a baby in training? And so, um my last year of residency training, I knew that I was going to be going into fertility. And so I decided to do some baseline testing and found out that my ovarian reserve was extremely low, or egg count. And that doesn't predict fertility, right? We weren't actually trying at that point because we were busy. I was at that point doing 24-hour calls every fourth night. Like, how would I
Wow.
ever take care of a baby? Um, so, so found out I had a really low egg count and thought, okay, let me freeze some embryos. Actually,
Were you matter of fact about it when you found it out because of what you did? Were you like, okay, it's fine. This is what I'm going to do?
absolutely not.
Oh, okay.
Absolutely not. And so that's part of like what leads me to share my story is I see a lot of women who kind of find this out incidentally, right? Who go to their OBGYN or their primary care doctor, or, we host all of these kind of AMH events and check their AMH, which is really the only blood test that can give you a marker of how many eggs you might have. And you know, I tell patients this all day long that it doesn't correlate with fertility and don't freak out if it's low and all of that. But the moment, I mean, fertility is sort of one of those things that if a family is important to you, that you always just think, okay, I'm going to like snap my fingers. I'm not ready. I'm not ready. I'm not ready. But when I am, it'll happen. Right. And whenever you find out any piece of information that feels like that could be in question or not as easy as you thought, it feels really violating and you feel like you're like losing control. And it's very scary because you don't have anything that can really truly reassure you, right? If you're not ready to create a family. And, you know, I think that's one of those things where even if I can like scream it from the rooftops, it does not reflect your fertility, right? Because fertility or the chance that somebody gets pregnant in a given month, right? Everybody, no matter what your number of eggs is and your total number of eggs, whether you were born with a lot or fewer, everybody just gets one opportunity per month. I mean, unless rare exception is twins or, you know,
Mhm.
but everybody gets one, right? The rest of those are dying away each month. So for as far as fertility goes, or the chance of getting pregnant each month, it really doesn't matter how many eggs you were born with. And someone who has a lower number of eggs could be more fertile, so to speak, than someone who has a high number of eggs. But what it does tell us is that should you need fertility technology in the future, whether you're thinking about freezing for fertility preservation or for difficulty conceiving, that a lower number of eggs makes it that much harder as we age and then are facing quality issues, right? So, so we decided, my husband and I knew that we were going to be apart for potentially 3 years as I finished fertility training and he was finishing his orthopedics training. And so we were thinking to freeze embryos. At the time, I had an IUD in, and now we have some better data that's come out that leaving an IUD in place is okay. But at that point, it was kind of more of a question mark. And so I was like, okay, well, I know this isn't going to go well. Let me just remove this. And so I pulled it and actually went in to start to freeze embryos and was pregnant. So that's my first son. And so I'm like the poster child for like a very low AMH even does not reflect your fertility. And I think sharing that with people who are going through that initial scare of like, you know, this is low. I'm, really feeling like my family's in question, that's helpful. And so then I had my first son. We kind of came with all the struggles of doing long distance with a baby and all of that. It was wild. Um, and then we started trying for my second. We ended up doing IVF. And so I had that break, right? So the pregnancy was a beautiful surprise in so many ways. I mean, brought me my first son, but it also let me kind of get my ducks in a row to study needle-free IVF, right? Because I had that time of like, okay, let me spend that 10 months or whatever it is, finding the catheter, getting things in place. And it actually was like a 2-year delay to when we actually did the clinical trial, tried it on myself and then the clinical trial. And then had my second, the cycle went very well for a low number of eggs, had my second son. And it was always really important to me to have a big family. And so kind of, I always talk with patients too about this position that I'm in now of, being someone who's really committed to my career and really committed to, taking care of my patients now. I have these two boys that are absolutely insane, but I really do want another. And I think having frozen embryos is such a gift, right? I think it's never full guarantee, but it really lets you do things on your own timeline. And so I talk about that with patients all the time. Like, it, I think I would feel so much anxiety about rushing into that next baby if I didn't have this gift of knowing that there's a backup here. And so I think it just, my journey with it all and creating my family, which isn't hopefully completed yet, just, brings up a lot of important topics about how we time things, how we and how we use technology to our advantage, and as like multifaceted women, right?
100%. It is, I say it all the time that it amazes me that we live in a world that it's possible to be doing
Yeah.
that. And as I started this podcast on, like, how do you do it all, right? Like, it's not easy. I think a lot of us make it look easier than it is. I have 3 little boys too, and it's a lot of work, but also when you're passionate about what you do, I think that shows your kids and your family too that you can do 2 things.
Yeah.
And I think we're always our worst critic. I'll speak for myself. I am, but at the same time, I wouldn't change the situation that I have with them now either. And I think to having the banked embryos, so to speak, to have that ability is life changing in so many ways for so many people, because it does give you the flexibility that you wouldn't have normally had, and not to feel like the clock is weighing so heavy on you all the time, because the reality is that is how it feels
Yeah, and I
otherwise.
think some people don't think, like, if they're struggling for their first or even their second baby, but they think that they might want a future child even after that baby. I always talk about not just, oh, it might be difficult for that one too, right? Because everyone's thinking that, but also trying is can be really traumatic, right? And so you
Mhm.
have that next baby and you're so, happy and, relishing being with that baby, but that anxiety of what you went through is still there and like creeps up on you, I think. And then, um, I imagine as being a type A person, right, that I'd be like, okay, let me cut that time short because I know that this could be really difficult, right? And so I think that it's just, as I said before, like such a gift to have that flexibility and kind of peace of mind, kind of going through these couple years here.
Yes. Would you recommend that way for people for kind of anybody to do? Like, I know some doctors don't always recommend that, right? Because of the risk. It's not a guarantee, whatever. What's your opinion on, like, couples doing this if they already know they want to grow their family later, but they're in situations of like a crazy work time or building their business or whatever it may be?
Oh my gosh, I recommend it wholeheartedly. I mean, I think that yes, nothing is a sure thing, right? If you have 2 embryos, that puts you, 85 to 90ish%, 3 above 90% of a baby. So it's not, 100%. And so people have to know that going forward, but it's a much more sure thing than having frozen eggs, right? And we just have to always keep in mind that eggs, embryos, it's never a full guarantee. The only guarantee is like actually getting pregnant and doing it, right? Um, but I think that it has given me and so many of my patients more opportunities here and to do things on our own terms. And I am a big advocate for freezing. And the other thing is, I think, you know when we talk about this, I think it really helps remove some of the stigma that I see from women who are coming in to freeze their eggs. Whenever people come in to freeze their eggs, I meet so many women where it is, and I totally understand that it is such an emotional process and that sometimes it brings up feelings of maybe not being where you thought you'd be at this age. But I think egg freezing, there's some stigma behind it as like, oh, I'm this age, I haven't yet met a partner, I'm gonna have a baby later on, and I'm therefore gonna freeze my eggs. And I think that we should really flip that script of like anybody, no matter if you've met your partner, no matter if you're single, if you haven't finished creating the family that you want, right, then we should freeze something, whether it's eggs or embryos, because, it's just about reproductive options. Ovarian aging is happening to all of us, whether it's for baby number one, two, three, four, five, whatever it is. And so I think talking about that more also kind of helps remove some of the stigma from egg freezing and maybe makes people a little bit more willing to just come do it as, I just want to have frozen eggs, like, or I just want to have this for future flexibility.
One last question: the eggs versus embryos. So when I was doing it, there was a big delta between thawing eggs versus thawing embryos.
Mhm.
Studies show and say that there really isn't much now with the process of how the technology is. Maybe it's just because of my own experience going through it, but I still feel like the makeup of the embryo versus the makeup of the egg still would thaw better. What do you know, just in your expertise today, of
Yeah.
where things stand?
So you're right in that historically embryos have withstood the freezing process and are more hardy, so to speak. This is because an embryo, when we freeze it, is made up of a couple hundred cells, right? And so it is a more sturdy structure than an egg. And an egg is one of the biggest cells in the body, and it's filled with water. And so when our older freezing technology, before we had something called vitrification, which is like an ultra rapid flash freezing process for an egg where it goes to like a solid state almost instantaneously. The older technology, we used to see ice crystals form in the egg, and that would damage parts of the egg, and we didn't have good survival rates when people came back to thaw eggs. Now that has changed with vitrification over the last, decade and a half. And that has really been what has allowed egg freezing to go from something that was considered more experimental to something that we feel like we can rely on to some extent. Now, it is true, though, that there are advantages to freezing embryos, and most of that is having the knowledge, right? The survival rates are still probably slightly better for an embryo, but not so much so that I would ever tell someone to fertilize eggs with sperm that they weren't 125% sure of, right? Um, they're similar enough that I think that it makes sense to freeze eggs if that's the better move for your life. But we do gain important pieces of knowledge with regards to egg quality and embryo quality when we create embryos. And this is because, um, with egg quality, the biggest part about egg quality is, does the egg give the right amount of genetic information to an embryo? And when an egg is an egg, we can't learn if the egg has made any mistakes, because if we could send that egg for genetic testing, but then it would damage and kill the egg, right? We can't use it. And so we can't do that with an egg. We can only infer success rates from how many eggs someone froze at whatever age they are or were when they froze the eggs. And looking at the data from IVF of people who have people of their age group who have taken those eggs, fertilized them, created embryos, and tried to create pregnancies from those embryos. So it's really taking data and estimations and trying to apply it to one person, which is never such a great thing. Um, but it's the best we have when it comes to eggs. With an embryo, you're really then able to fertilize the eggs with sperm, see how they develop, which is due to egg quality and sperm quality, and then create an embryo, which then we can test to learn, does the embryo have 46 chromosomes, and that testing, which we call PGTA, really helps us predict which embryos are most likely to lead to a pregnancy, right? And so there's many different roles for this testing, but particularly with embryo banking, it lets us be a lot more sure of what we have, right? Once you have a normal embryo on the genetic testing, right, we think it's about a 60% chance that that embryo implants and becomes a pregnancy. So it's kind of comparing apples to oranges, and we have a trade-off here, because when you create embryos, you just get a lot more knowledge about what you have frozen, and as compared to eggs. But I think there used to be a point in time when we would tell people, well, pick a donor, fertilize your eggs or something, because embryos have a lot better survival. And I think we are not living in that era anymore. And there's been a lot of advancements.
Right. Well, thank you for all of the information and the lessons. I feel like we just went to school a little bit, which is always fun. And I agree. I'm a full-heartedly say too, if you have the opportunity to freeze your eggs, do it. If you can freeze embryos, do it. I don't think you will regret it. I haven't met anybody who regrets it. I did it and was not able to use my eggs, and I still don't regret it, because I felt for that time I was doing what was right for me in my life, and it allowed me the space to feel confident that I would go on to have my family. So thank you so much for being here, Dr. Mandelbaum. And where can people find you?
Yeah. Well, thanks for having me. I love connecting with people on social media. So on Instagram, my handle is rachel.mandelbaum.md. And I practice in Los Angeles. I'm in West LA and Beverly Hills. So anybody who's nearby, happy to see them in the office too. And always happy to talk about these things.
Wonderful. Again, thank you for your time. Thank you for joining us on this episode of Friends with Fertility. We hope that you found the stories, insights, and tips as inspiring and informative as we did. Remember, you are not alone on this journey. Your friends with fertility are here for you. If you've enjoyed today's episode, please subscribe, rate, and leave a review on your favorite podcast platform. And don't forget to follow us on social media for updates and more fertility resources. Until next time, stay hopeful and keep believing in your journey, and know that we are sending you lots of love.